And what is your approach to the early treatment if you could get diagnose something or indications real early? Would it, one, save a lot of lives, obviously? Would it save a lot of money, too, would it not?
Oh, absolutely, absolutely, Senator. Our survival for early stage ovarian cancer, stage 1 and stage 2, approaches 80–85%.
Something else that got my attention here, because as I said earlier, I'm the ranking Republican on another subcommittee dealing with NIH and so forth. And and I'm new as far as ranking on it, but you're pointing out that funding for this cancer research in this area has remained flat, if not declined and that there was one ovarian cancer specialized project of research excellence that had been awarded to Duke and the University of Alabama, Birmingham, and it was cancer. What happened there? Was it not promising, or what happened? Because I'd be very interested in that.
Specific details of that I will certainly forward.
Will you send it to me?
Absolutely,
and I'll
Senator.
share it with the committee.
Please.
Thank you so much.
Thank you. Thank you for your time.
Thank you very much. Now may I call on Mr. Schwartz?
Thank you. Mr. Chairman and distinguished members of the subcommittee, thank you for the opportunity to share my thoughts. I know this has been a long session, and I admire your dedication. Hopefully the last is not least here. My name is Jonathan Schwartz, and I am the chairman of the board of directors of ZERO, the Project to End Prostate Cancer. I'm here to stress the importance of research at the Congressionally Directed Medical Research Program, and particularly the Prostate Cancer Research Program. ZERO is a patient advocacy organization that raises awareness and educates men and their families about prostate cancer. Of particular importance to us is the issue of early detection. Not only do we operate a mobile screening program, we also work with policymakers in Congress and throughout government and other organizations to ensure that men have access to information and services to make decisions that are in the best interest of their health. My dad was William Schwartz. He was diagnosed with prostate cancer at the age of 55. We thought he'd be okay because the cancer was detected early. Unfortunately, his cancer was very aggressive and had already spread to his lymph nodes. The doctors gave him just 2 years to live because back then there were very few treatment options for prostate cancer. Thankfully, new treatments became available that extended his life. He fought the disease for 8 years, and during that gift of time, he saw all his children get married, became a grandfather, and in between chemo sessions was able to travel and enjoy the company of family and friends. He also volunteered as the first CEO of the National Prostate Cancer Coalition, which is now ZERO. He worked tirelessly to increase federal research funding because he knew that research would help him and countless other men. As a family, we enjoyed much of my dad's last years, but he also experienced great suffering. We saw firsthand the impact of this cruel disease. My dad died at age 63, younger than when most people retire. We all miss him dearly and wonder what it would be like to have him in our lives today. I still find it hard to accept that he will never get to meet my 2 daughters, and they'll never get to know their Papa Bill. Our family's experience has led me, my brother and sister, and of course our mom, to care deeply about Dad's cause. We don't want other families to go through this. We want the number of men suffering from prostate cancer to be as small as possible. Eventually, we want that number to be 0. I'm here today because of my dad. I'm here today because prostate cancer affects the family, not just the man. And as I mentioned, I'm here today because I want to stress the importance of research at the Prostate Cancer Research Program. Prostate cancer is a disease that's diagnosed in over 200,000 American men each year and will kill nearly 34,000 men in 2011. It's the second leading cause of cancer-related deaths among men. 1 in 6 men, 1 in 4 African-American men will get prostate cancer, and some will only be in their 30s. It is not just an old man's disease. There is much controversy about prostate cancer, and particularly the controversy over testing. When men should start getting tested, how often they should be tested, what type of treatment a man should undergo when diagnosed. I recently met with my Georgia senators on this topic. Senator Chambliss, a prostate cancer survivor whose life was saved by early detection, said it well when he said, "You have to know you have it to have a choice about treatment options." Despite what some people call overdiagnosis, the number of men dying from prostate cancer is rising. So, Mr. Chairman, the problem isn't the number of men we are or should be testing. The problem is knowing whether they have an aggressive or indolent disease and whether or not they should be treated. The only way doctors will ever really know the answer to these questions is through advances that may be closer than we think. Last year, research partially funded by the Prostate Cancer Research Program identified 24 different types of prostate cancer. 8 of these are aggressive forms of the disease. If we could identify what type of prostate cancer a man has, we could have more effectively determine if he needs treatment and how aggressive that treatment should be. This would render moot the argument some make about the disease being overtreated and ultimately save men's lives. Another innovative funding mechanism of the Prostate Cancer Research Program is the Clinical Trials Consortium. To address the significant logistical challenges of multi-center clinical research, the Clinical Trials Consortium was started to promote rapid Phase 1 and Phase 2 trials of promising new treatments for prostate cancer. Since 2005, nearly 90 trials with more than 2,600 patients have taken place, leading to potential treatments that will soon be available to patients. 2 recently approved drugs, Xgeva and Zytiga, benefited from the consortium, accelerating their approval time by over 2 years. Today, without adequate funding, the program cannot support this award mechanism. The Prostate Cancer Research Program is funding some of the most critical work in cancer today. The program uses innovative approaches to funnel research dollars directly into the best research to accelerate discovery, translate discoveries into clinical practice, and improve the quality of care and quality of life of men with prostate cancer. It is the only federally funded program that focuses exclusively on prostate cancer, which enables them to identify and support research on the most critical issues facing prostate cancer patients today. The program funds innovative, high-impact studies, the type of research most likely to make a difference. I understand that the committee is working under extremely tight budgetary constraints this year and that many tough decisions are ahead. This program is important to the millions of men who are living with the disease, those who have survived the disease, and those who are at risk for the disease, including our veterans and active duty military personnel. Active duty males are twice as likely to develop prostate cancer as their civilian counterparts. While serving our country, the United States Armed Forces are exposed to deleterious contaminants such as Agent Orange and depleted uranium. These contaminants are proven to cause prostate cancer in American veterans. Unfortunately, the genomes of prostate cancer caused by Agent Orange are the most aggressive strands of the disease, and they also appear earlier in a man's life. In addition, a recent study showed that Air Force personnel were diagnosed with prostate cancer at an average age of just 48. In closing, I ask that you support our fight against all cancers, and in particular prostate cancer. Prostate cancer can and should be 100% detectable and treatable cancer, and hopefully someday a preventable one. Please support the research conducted through the Congressionally Directed Medical Research Program and the Prostate Cancer Research Program by maintaining their funding levels. Thank you very much for your time. I'd be happy to answer any questions.
Thank you, Mr. Schwartz. Senator Cochran.
Mr. Chairman, I think it's important to note that the testimony here reminds us that while we're learning more about cancer, we're wondering why cancer is killing more people every year in the general population, but fewer, but more of prostate cancer. Prostate cancer seems to be on the rise. Other life-threatening cancers are on the decline. Another thing I think in the witness's testimony that's appropriate for this committee to consider when we decide how much funding is available, if any, for this program, is that Agent Orange has been identified as a causal connector with prostate cancer for those who've been exposed to that substance. And this is something I think that's peculiarly of interest to the military and appropriate for this committee's attention. So I'm hopeful that we can find a way to support, as this witness suggests, an increase in funding for prostate cancer research. And we appreciate your bringing these facts to the attention of the committee.
Senator Shelby.
Mr. Chairman, I'll be brief, but I would not, I'd be remiss if I didn't use this. I'm a 17-year I'm a 17-year survivor of prostate cancer. I have been through that as you went through it with your father and your family. A lot of people don't survive. It's my understanding that I've been told that prostate cancer is the #2 killer of men, in this country. And research and new surgery procedures, everything else, early diagnosis has helped save a lot of lives. And I agree with Senator Cochran. We don't need to cut back on this because, if we do break through the research, we're going to not only save lives, but this on a policy level, and we will save money down the road. You can do both if we do it right. Thank you, Mr. Chairman, for calling this hearing. This has been a very good hearing for me, as I've pointed out, that am the ranking Republican over on the other subcommittee dealing with NIH and all the other, and I'm curious as to how this works, and I've found out a lot today. Thank you, Mr. Chairman.
All right, thank you very much. 3 organizations have submitted testimony without objection. Testimony of Commons Incorporated, Washington State Neurofibromatosis Families, the American Foundation for Suicide Prevention will be made part of the record. And in behalf of the committee, I thank all the witnesses for their testimony. And the subcommittee will take these issues in consideration, and I can assure you we'll look at it very seriously. The subcommittee will stand in recess, but will reconvene on Tuesday, June 28th, at which time we'll meet in closed session to receive testimony on FY 2012 budget for intelligence activities. Committee's adjourned.
Thank you.